I was wondering
Okay.
about the time difference. I wondered if she.
No, she totally spaced. She sent an email, so we got it.
Okay.
So
Okay.
Travis, you want to go ahead and start recording?
Oh, let me stop.
Welcome.
It's recording.
Thank you. Everyone, welcome back. Although I'm sure most of you heard every conversation we just had during the break. So you know what goes on behind the curtain, so to speak. Steve is going to be ducking out. He has a previous engagement and we have to give him big kudos. We could not have done this without Steve. Third year in a row, Steve, you are the guru. So thank you very much, my friend, for all your help and assistance. I am very, very, very pleased to introduce Carol Paquette, former president of the board for Village to Village Network. She led the charge along with Mary Jane Atwater and Cynthia Kemp on this leveraging resources guide. And she's going to tell you the story and gives case studies. So I'm going to turn this over to Carol. I ask you to hold your questions, or you can put your questions in the chat. We will answer them at the end of the program. But right now, use the chat to say hello or make comments. If you have any comments about working with a AAA, feel free to put them in the chat. And again, Carol, go ahead.
Yeah, just a quick point of clarification. Please put your questions in the Q&A so that we have one place that we can easily find them to refer them to the people on the panel. Anyhow, thanks to all of you for coming. We just have a lot of material to cover, and so I'm just going to get right started. So Travis or Steve, whoever's showing the slides, if you could do slide 1, please. And while that's coming up, I'll just continue. So we're all familiar with the statistics about the rapidly increasing population and that nearly everybody wants to age in their home. You know, this is actually a good thing because there may not be many alternatives. The construction of retirement and life care communities is not keeping pace with demand, and costs continue to go up. So remaining at home may be the only practical option for most people. And we're still waiting for the slide. It's just the title slide. There we go. But many older adults will need some support to be safe, healthy, and connected to their communities as they age. AAAs are the primary source of assistance for those most in need, but there is a very important role that villages can also play. And working together enables more older adults to be served. Next slide. Collaborations between AAAs and villages seem like a very natural fit. To be successful, it may require both parties to make adjustments. So we're here today to share the experiences of villages and AAAs who are experimenting and working in a variety of ways to broaden older adult access to the needed supports and services. We hope that you will all find inspiration in these examples and go home and explore the possibilities with your own AAAs. What you're seeing in this slide is the cover of the Leveraging Resources Handbook, which is the product of the 7-month research project. We're going to be releasing this report today, and I'll get back to that a little bit later on. I'd like to say that the network greatly appreciates the funding provided by the Next 50 initiative that made this effort possible. We're also very indebted to US Aging for their assistance, and especially for their careful review and thoughtful comments on the report. The full project results are documented in the handbook. Today, we're just going to cover just the very bare bones highlights. And then we have 3 case studies that I think you'll find very informative. Let me take just a moment to introduce the research team. As Barbara mentioned, Mary Jane Atwater, who's a Village to Village board member, and Barbara, our RED, participated in the project, along with Cynthia Kemp, who's a consultant from K3 Strategies. It was a great pleasure for me to work with this group of ladies, and we had a great time doing this project. Mary Jane and Cynthia will be joining me for the Q&A, and we're actually joining all the panelists for the Q&A at the conclusion of the discussions. Next slide, please. I'm going to start with just a little background about AAAs because not everyone may be familiar with these organizations and their work. The Older Americans Act, which is the foundation of the federal, state, local, national network of aging services, was passed as part of the Great Society Initiative, along with Medicare and Medicaid. Its goal, as stated here, is to support older Americans to live at home and in the community with dignity and independence as long as possible. That's certainly a goal that we as villagers can relate to. AAAs are designated as the lead implementers at the local level for the provisions of the Older Americans Act. Next page, slide. There are more than 600 AAAs nationwide, and as you can see here, they have a broad scope of responsibilities and funding sources. I found it very interesting that if you look at the business models box, many AAAs are not always government agencies. They may actually be independent nonprofits. There's much more about AAAs and how they're organized and they operate in the report. Now, I'm sure you've heard the expression, if you've seen one village, you've seen one village. The same can actually be said of AAAs. AAAs are expected to consider local needs and preferences and to tailor their programs to fit their local communities. With our grassroots focus, villages are also very responsive to local needs. Again, although their business models and priorities may vary somewhat, the core functions and services of AAAs are very similar. That's also true of villages. Next slide. Here are some of the factors that led us to conclude that there's a strong basis for villages and AAAs to work together. They have a shared goal, they serve the same people, and they offer many complementary programs and services. They both also partner extensively with many of the same organizations in the local aging services network in order to meet their goals. Next slide. Let me just give you a quick picture of the scope of the project. It includes large and small villages and AAAs. As you can see on the map, there's nationwide coverage of urban, suburban, and rural locations. We also found a lot of variety in the origin and nature of the collaborations. As a result, we believe our findings reflect the range of potential opportunities that can be widely replicated. Next page, next slide. I want to underscore that the statements on this slide and the next one are the words used by AAA and village respondents when we ask them about the benefits of collaboration. These are not interpretations that the research team made or words that we put in their mouths. So first, let's talk about the AAAs. AAAs find villages to be an effective way to expand their reach and augment their programs, and also often as a very good means to connect to underserved groups. For example, Golden Age Village in suburban Baltimore serves congregate meals for a Muslim community, which the AAA would otherwise find difficult to reach. Several rural villages enable AAAs to serve more older adults in hard to reach areas. You'll find many examples of this in the handbook. Another indication of the value that AAAs place on villages is that both local and state aging units include villages in their plans on aging. There's also reciprocal participation in each other's advisory groups, committees, and boards. Next slide. Here are the benefits that villages most often mentioned. You know, partnering with the AAA is something like getting a good housekeeping seal of approval. Working with the AAA results in greater community visibility and more recognition of the value of villages. Promoting sustainability is another big factor. Some collaborations involve reimbursements But even those that are non-financial open doors to other partnering opportunities and enhance village credibility with grant makers and donors. Next slide. We found a wide variety of collaborations that we grouped into 4 categories. Many of the case studies involve multiple categories. So let me tell you about these a little bit. For village startup, sometimes a village, a AAA might advise, help with planning, or provide funding or other support to village planners. Or they might even start a village as a AAA program. Community Connections of Findlay Lake is one of several examples in this category. The program support category reflects a very wide variety of activities. Both organizations benefit from cross-promoting programs and services and making referrals. They may co-host events and share resources such as meeting space or equipment. The Chicago Hyde Park case study, which you will hear from shortly, is an example of a village creating additional modules for a AAA training program. These types of activities are an easy starting point for building a village AAA relationship. Villages are also engaged as direct service providers, both with and without reimbursement. Villages develop and share special interest programs, which may be funded by grants. There are terms and conditions associated with funding that villages need to be prepared to manage. And I'll come back to this point a little later on. Let's talk about capacity building. We define this as enhancing the organizational infrastructure for more effective program management or to support expanding program scope. Some examples are AAA's training village volunteers and funding data management software. Villages help AAAs extend their outreach to underserved populations and provide additional support for high demand services. Some AAAs promote the development and expansion of villages as a strategy to reach underserved populations and expand access to services. The San Francisco and Findlay Lake case studies that you'll be hearing about later are examples. Finally, planning and coordination. This category includes villages serving on AAA boards, advisory councils, and planning committees to bring the village perspective to the policymaking process. AAA representatives can provide a community needs perspective to village boards and committees. This is another easy entry point for starting to build a AAA relationship. I have to just make a very quick related sidebar on this point. I have a call to action for my fellow Virginia Village members. This weekend, you received an email from WAVE about the older adult survey that the Virginia Department of Aging and Rehabilitation Services is conducting this month to get community input for the state plan on aging. Please encourage your members to participate. Also, we will be working on a white paper from the Virginia villages, so stay tuned for more information about that. How perfect to have the opportunity to make this announcement today. Next slide. So we want to get into some of the key learnings that we took away from this research. So for starting a collaboration, obviously the first step is to prepare. Some of the very important points there is you really need to understand where the village fits in the AAA environment and in the aging services network in your community. My number one recommendation is that you read those state and local area plans on aging. They give a very good picture of community needs and they describe AAA priorities, programs and services, and budget. There's no better place to get started to get acquainted with your AAAs. Next, you need to advocate. You need to build broad community awareness of village benefits. Many villages noted that they identified elected officials either with AAA oversight or with an interest in improving supports for older adults. They met with those villages and told the village story. The villages met with those officials and told the village story. and identified a champion where they could that would help promote their message. The next step is to engage. Important thing to remember is that you're building a relationship. This is not just a business transaction. One way to do this is to attend advisory group meetings, to learn about the other players in the aging services network, the leadership, the current issues, and to introduce villages to the network. You can volunteer for a working group. You can invite AAA representatives to village events. And finally, you need to cultivate the relationship. We advise that you start small and be patient. The more complex collaborations that we found took years to develop. In the case of A Little Help in Denver, it was almost 8 years before they got a relationship with their AAA. So don't be in a hurry. Because you're looking at a long-term relationship, but you're starting small, it's important to define what type of collaboration you're seeking right now and where you would like that to go in the future, and to plan accordingly. You can initiate a relationship through informal cooperation, some of the activities we've mentioned, like cross-promoting services and events, co-hosting programs, educating your members about AAA services. Next slide. Okay, so now you've got your collaboration underway. What are the things you need to do to be successful? Communication, of course, is the key to every successful relationship. And needs to be clear, frequent, and open. You need to use all the channels, formal and informal, that you have available to communicate with your partner. And any issues that arise need to be addressed immediately. On the partnership side, you can demonstrate that the village is a trusted partner that is invested in the lives of older adults. You need to make sure that both parties are realizing a benefit. You should be proactive to identify and implement process improvements, and stay current with evolving community needs and AAA priorities. On the results side, be sure that you're helping the AAA achieve its goals. Deliver high quality programs and services, and be inclusive of underserved populations. Evaluation is a factor that is sometimes a formal requirement of a collaboration. But even if it isn't, you should regularly assess if objectives are being met by both parties. And you should periodically assess how AAA collaboration fits with other village activities and priorities. And innovation. We were pleased to hear several AAAs and villages bring up the word innovation relative to a benefit of villages. Villages are small, flexible, and nimble, and can be what one AAA characterized as an innovation sandbox in ways that larger organizations can't do. So you need to be able to adapt to new opportunities and challenges. And I think we all demonstrated very well the ability to quickly pivot and change our approaches in response to COVID. And you need to be open to new ways of working with other organizations and villages. Now, these points that I just made in these last two slides, there's much more information on these points in the report. So as I said, I'm just really trying to skim over and give you some highlights. Next slide. These are a few things to think about, especially when funding is involved. I'm going to start with standards of practice. AAAs are subject to the program priorities and standards set by their federal and state funding agencies, and they must follow prescribed policies and procedures. Many of these requirements will flow down to the village as conditions of funding. In addition, the AAAs may define service parameters and prescribe qualifications for volunteers performing services. So that if you wish to be a service provider for the AAA, the village will have to conform with those requirements. Data collection and reporting is another big point, and I think our San Francisco villages can speak eloquently to this particular point. AAAs collect detailed data on the recipients of their services and the people that participate in their programs, and they have to evaluate and report on the effectiveness of their activities. Villages may be required to do the same when being funded. There's typically a prescribed monthly report, as well as other periodic reports and audits. Another thing to consider is the village management capacity. We have concluded that it's likely that only a mature village with paid staff will have the management capacity to make the kinds of operational adjustments needed and to handle the reporting and evaluation requirements that a financial relationship may entail. So when you're thinking about getting funding from a AAA, we encourage you to think about, many of these factors. I would like to throw in just one exception, and that is the case of village planning groups. Village planning groups should connect with their AAA early in the development process to find out what assistance might be available. This doesn't necessarily mean getting funding, but there are many other ways that a AAA can help the startup process. And there's lots of excellent information that they can provide about community needs and services. And finally, organizational cultures. Again, we had many respondents, both from AAAs and villages, express some concern about the potential impact on the culture of villages from the administrative requirements that are associated with government funding. We need to bear in mind that while we do share a similar mission, we work with the same people, we do many of the same kinds of things, we do have very different roles and operating environments. So villages need to carefully weigh the costs and benefits and strike what is an appropriate balance for them between their village values and the conditions associated with government funding. Next slide. So just to wrap up, as we all know, the need for home and community-based support is increasing. We heard yesterday about many organizations that have waiting lists that they are finding difficult to meet. Villages and AAAs working together can leverage their resources and maximize their community service potential. The Leveraging Resources Handbook provides many examples of how villages and AAAs are doing this today. Next slide. Most importantly, although both villages and AAAs can benefit from collaborations, in the end, it's the older adult communities that both organizations serve that will really reap the benefits. And next slide. We're now going to hear from 3 case studies: Chicago Hyde Park Village, an age guide of Northeastern Illinois, Community Connections of Findlay Lake, Chautauqua County Office of Aging and the New York State Office of Aging, and Next Village San Francisco Village, and the San Francisco Department of Aging and Disability Services. That sounds like a lot of stuff, and it is, because these are 3 very fascinating case studies. And we selected them because they illustrate a really good range of collaboration approaches. So I'm going to turn it over now to Chicago Hyde Park Village, an age guide, Northeastern Illinois, to introduce themselves and to tell us their story. Thank you.
Thank you very much. I'm Dorothy Pytel from the Chicago Hyde Park Village, and I'll let my co-presenter introduce herself as well.
Hello, I'm Lucinda Hurt from Age Guide. I am the manager of access services and community programs here. And can you see the right screen of the presentation?
No, you don't have the presentation on yet.
Okay.
Yeah.
Is that the? It says I'm sharing.
You are sharing.
Okay. Is it the regular screen or the note screen?
It's the note screen.
Oh,
Yeah.
let me switch it back. When we tested it earlier, it was the other way around. Is that the correct one?
No, Travis.
It didn't change.
It didn't change. Okay. Let me change how I share. It was working before.
It's all right. Take your time. We love technology.
Yes, yes. I'll just do screen. Well, I'll do screen one. That should. Is that better?
There you go.
Yeah,
Yep.
that looks
Okay, okay.
wonderful.
Screen
So-
versus file share. Okay.
Well, welcome everyone. We're going to be talking about promoting dementia-friendly businesses. So if you can advance to the next slide. We already talked a little bit, but we'll give you a little more detail. So I'm from the Chicago Hyde Park Village. Just to give you a sense of our size, our village has about 200 members, about 80 volunteers. And back in September of 2020, we became the first dementia-friendly community in the city of Chicago. We really used that initial pandemic time to apply to become a dementia-friendly community. Lucinda, do you want to?
Yep. And so we're Age Guide Northeastern Illinois. So we are the area agency that serves what we call the 8 collar counties around Cook County, which is where Dorothy is in Chicago, is part of Cook County. So we have about 700,000 older adults in our region. We're the largest populated area agency region in the state, with then Dorothy's region, which is Chicago City, and then the suburban Cook County has its own region as well, which you'll see on a map here shortly. But we serve the largest population here.
Great. Next slide, please. So why are we working on dementia-friendly initiatives? Well, as we already heard a little bit earlier on, I mean, the need is ever increasing. So these are some statistics for our region, which is the state of Illinois. In 2020, the prevalence of Alzheimer's, there were 230,000 cases. It's anticipated just a few years later for that to be 260,000. So that's a 13% increase. The same goes with workforce. There's going to be a huge need for increased geriatricians and for home health. In fact, I just got an email right before about a family in our community needing some assistance on that. So there's just a real intense need, and it's only going to intensify. Can we get the next slide? So what are some of the challenges that people with dementia experience? There's issues with communication, becoming lost, particularly in previously familiar locations, losing things, and then, for instance, being unable to retrace one's steps and to relocate the items, like including something as basic as a car as well. Frustration with that process. Repetition, repeating the same thing and not realizing you had just discussed it, 10 minutes earlier. Decreased poor judgment, it could be something as simple as walking into a street on a red light, which could have tragic consequences. Unacceptable behavior, talking in public about very private things or a number of other things. And then just a general confusion with time and or place. Next slide. So how did the two of us meet? So we actually don't work in the same region. So the Chicago Hyde Park Village is then located in number 12 there. And then you can actually see there's a section in Lucinda is in section 2, which is the brown section. And there's actually, if you can see the 13 in between, there's actually some suburbs between us. So it's not a natural partnership in that way. So it's definitely what I would consider more of an outside, outside of the normal way that you would work. But what we did do is we met through this Dementia Friendly America initiative, and specifically in the state of Illinois, we have a monthly meeting via Zoom. And because it's via Zoom, it's fantastic because people from Southern Illinois who normally would not interact with people from Chicago, but even people from the Chicago area and the suburbs, because of Zoom, it just makes things so much easier, just like we are at this conference. And we very quickly realized that Age Guide and the Chicago Hyde Park Village had a common interest. We really wanted to increase the resources available for businesses. Age Guide already actually has a very robust on-demand training for all types of businesses. They've been working also with first responders, faith communities, and all those kinds of situations, but they didn't have any kind of modules for restaurants and retail businesses. And but in the Chicago Hyde Park Village, we have an advisory committee that has really identified outreach to those areas as key. And so because of that, we reached out to Age Guide, and they were very open to expanding their this on-demand training to include restaurants and training. And what the Chicago Hyde Park Village, even though we're tiny compared to Age Guide, what we had was a dedicated intern that we could then assign to help develop the restaurant and retail modules that were based on the previous ones that Age Guide had made, so that they would be consistent with the other work that they have. So it was really sort of a sharing of resources. Next slide.
So just a little bit more about dementia-friendly business training. Like Dorothy said, we have developed modules in our Age Guide Learning Center, which is an online learning center that are tailored to various business sectors. So dementia-friendly business training presents and discusses challenges and strategies that businesses can utilize and run into when working with people with dementia and really other cognitive impairments, such as them forgetting to pay, needing to use the restroom, but maybe not really knowing how to find it, being overwhelmed by background noise and a lot of stimulation. It provides communication strategies to ensure that a person with dementia and their care partners are treated with dignity and respect, and that employees are not talking past the person with dementia. You know, that happens a lot as you get older, or if you have disabilities where someone is speaking to the person that's with you, your care partner, rather than speaking to you and acknowledging your presence in the conversation. It provides examples such as signage, like in this picture, that is clear and visually friendly, so that businesses can properly direct and guide people through their building. And it talks about the various adjustments and accommodations that can support populations with not just dementia, but also cognitive impairment, and outlines how to be a dementia friend. So some things that businesses can do when creating a more dementia-friendly environment are employees wearing visually friendly name tags that have pictures and have a font that is more appropriate for visually impaired persons. Businesses can have flexible return policies for caregivers. They can display signs, as in the other slide, that clearly mark where exits are, where restrooms are, and any other key points, key places in those businesses. They can ensure access to fitting rooms and restrooms. These rooms should not only be large enough to accommodate persons with disabilities, but also be gender neutral. Caregivers and their care recipients, be it with dementia or not, often are of different genders. And so that presents an issue of which bathroom do you go into, you know, if you are a single parent or just out with your child. That often happens. Similarly, when you are the father of a daughter, or you're the caregiver who is male and needs to care for your female care recipient. We see this happening in the pandemic, that grocery stores and businesses also allowed for older adults to shop in the morning so that there was less to help accommodate the public health concerns. But many businesses have taken that back, but should really keep those specific hours for older adults, because they may have more employees available. There's less stimulation, quieter music, and it's easier for people to get through a grocery store at that time. And also providing a quiet area where someone can decompress when they are experiencing a difficult situation, when they're overwhelmed, having an area in the building where a care partner can take their care recipient with dementia to calm down and regroup and be able to move through a store more easily. So why is it important for a business to become dementia friendly? As you've all talked about, and as Dorothy cited in the other slide, the older adult population is they're going to be the largest age group in our population as a whole, and that persons with dementia over 65 is increasing by 13% in just by 2025. And so knowing how to serve persons with dementia will improve customer service and position businesses to be community leaders. When a business or a cohort of people complete the age guide training specifically, we send them a certificate and a window decal that we've created so that when people walk into their business, they know that that business is certified as dementia friendly based on the standards established by Dementia Friendly America. We're also working on images to post in an email or on a website. So when people are visiting or having online communication, they also know that that's something that the business has invested in. Of course, having good customer service always leads to more business and people patronizing that business more often. Older adults have high spending power, and being able to accommodate their needs, the needs of persons with dementia, can only increase that business and therefore increasing profit and maintaining those businesses. So if you'd like to learn more about becoming dementia friendly as in your community, Dementia Friendly America has a wonderful, thorough website on how to do that. They have really set up, I think, based on Minnesota's efforts, the toolkit, timelines on activities, and really set people up for success with what they have on their website. So just wanted to give out that resource if you are interested in taking that to your community. To become dementia friendly as a larger city, as a piece to that larger puzzle within your own communities. And that is the end.
That's right.
Muted.
Thank you very much for that presentation. And we're going to move on to, I believe, Tinley Lake is our next.
No, San Francisco.
Oh, sorry. Thank you, Barbara.
You're welcome.
San Francisco, the San Francisco Villages and the Department of Aging Services is the next case study.
Thanks, Kate.
Yeah. Hi, everybody. My name is Kate Hopke. I'm the Executive Director of San Francisco Village, and I am a founding partner and chair of Village Movement California Board of Directors. And I'm joined today by my colleagues, Jacqueline Zimmer-Jones from Next Village San Francisco, and also Cindy Kaufman from the San Francisco Department of Disability and Aging Services. And so I'm going to drive this, but Jacqueline's going to be the first person to speak. There you go, Jacqueline.
Thank you, Kate, and thank you, everyone. This has been a fantastic conference, so thanks to all the organizers and presenters. So I'm going to just give you a quick 30,000-foot view of how we came to receive funding from the Department of Disability and Aging Services. And so the origin is that about 8 or so years ago, Next Village San Francisco and San Francisco leadership teams approached our respective board of supervisors. And in your community, it might be your local county commissioner, it might be your city council, but the folks that are responsible for creating the budgets, the city budgets in your community. And we stated our case for new funding that would benefit their constituents through something that we have here called the add back process. So at the end of every budget session or season, each one of our supervisors receives a little pool of money that they can direct towards their own district. So we're fortunate that they have that capacity here. But we were part of that add back process. And so what we did was we created messaging that spoke to the unmet needs of seniors, especially among the middle class. We shared how many residents, based on their income, might not be eligible for certain city services, nor were maybe they aware that those services exist, or they might qualify for them, or they might not know how to access those services. And quite frankly, many people don't even realize that there is a Department of Aging in their community that they can turn to. We spoke to the value of villages helping to fill that gap in services and access through our staff and our volunteers. We spoke to the benefits of creating community and connectivity and engagement, and to the benefits of providing resource information on how to access services. And then we spoke to the concept of prevention versus damage control. So that means, how an individual with limited resources could very quickly find themselves in financial trouble because they had to spend down their own resources in order to receive support. It's obviously very expensive here in our community. And if we can keep people from spending down their resources and becoming Medi-Cal eligible, we're kind of a safety net for folks. That message was well received. And the result was that the supervisors and the mayor agreed to new funding for villages in that annual budget. And by the way, during that process, we're in contact with the Department of Aging, and they have a say, because the supervisors will turn to the department and say, what do you think of this request? And fortunately, the department said this funding is appropriate. But then following that budget process, the Department of Aging and Disability Services had to create an RFP, so a request for proposal. And they tailored that toward the village model. They released that RFP, and all the community partners in town had an opportunity to apply for it, but we had village experience, and we applied and received a small amount of funding for that first year, which was enough to help us expand our outreach and services. And then in subsequent years, both villages appealed to the supervisors for additional funds and were successful. So we used the same messages as before. We had even more data to prove our value. We enlisted members and volunteers to help advocate for those additional dollars. And we created, a one-page fact sheet demonstrating the efficacy of our programs that we shared with every supervisor and their staff, as well as the mayor's budget office. And we also worked with other community organizations to get their support while supporting their requests as well. And so now villages are part of the city's base budget. We're very fortunate to have the backing of the department. And now that we receive funding every year, we no longer have to go through that add-back process. As a condition of funding, we go through the RFP process, I think every 4 years. There's a very high level of accountability. So we undergo a thorough fiscal and program monitoring every year. We have to meet certain goals and objectives. So examples of that are mandatory minimum membership growth, number of volunteers, volunteer service hours, educational hours. I think it's 50 each year, meaning providing programming and information about services provided by the department and other community partners, other services, other information that promote independence and are of use to our members who are aging in place. So a few examples of that, or of how Next does that, for example, is we have a podcast called Not Born Yesterday. Every one of those episodes is educational. We have articles in our newsletter and on our website. And we also host events like this afternoon. We have one program called Medicare Open Enrollment Guidance. So if you want to learn more about educational offerings we provide, you should feel free to check out both Next Village and San Francisco Village's website, because we both host about 500 social, cultural, and educational events each year. So our calendars are chock full of that, as are our websites. We have to increase our diversity by 5% per year. And we must perform an annual member survey that demonstrates high satisfaction and retention rates. We input statistics into the city's database every month, so they can take a snapshot of how we are doing every single month. And then we raise funds independent of the city. So those are just some of the conditions of funding, but all of those are very doable, especially if you have a village-specific database. That platform is very expensive. I mean, not expensive, but important. And that helps us see where we are every month, and we report that information to our board as well. So we can always see that we're making progress towards those annual conditions of funding. I'm a former elected official and lobbyist, so if you have any questions about advocacy, please feel free to reach out to me. But again, we're very fortunate that the city does acknowledge the value of villages and expanding its reach, and we're just super lucky to have their support. So with that, I will turn this over to Cindy from the Department of Disability and Aging Services for their perspective.
Thanks, Jacqueline. I'm very proud to be here to be able to share the value that the village model brings to our department. So I think one of the main things is, for the department, social engagement is a huge priority for us. Major goal to reduce social isolation. And I think COVID highlighted that importance for the world to see. Villages for us are excellent at creating engagement and building community in and of itself. You all provide a sense of well-being, you promote civic engagement. These are all things that we have seen help reduce that isolation and build more social engagement. Our department also strives to serve all older adults and adults with disabilities, as was mentioned earlier. And we have lots of services for people with lower income, but very few for the middle income individuals. And so for us, the village model helps us reach that population. We are under the Older Americans Act. We try to serve everyone, but we just weren't seeing the middle income population in a lot of the existing services. So this is now the years that we've been working with both Next Village and San Francisco Village. It shows that the model helps us reach that population based on a lot of the data that we do get out of some of the things that we are looking at. So it's now a proven way for us to reach these folks and bridge them into existing services and resources for them. Things like HICAP, things like caregiver support services. We also like this particular model because it helps support active engagement by the members and creates a consumer-driven approach. Members truly create the villages that they want. The village structure is, and for us, it's an organized, informal network of support that people know they can turn to. So it breaks down the barriers. When you know someone, it's much easier to connect out to someone you've met or participated with in some way when you actually need some support. It kind of brings us back to the days when you could literally turn to your neighbor, which is something that I love. And then in addition, there's the education, there's the activities, but there's also access to additional services that we think for our department is really important to us. The Department of Disability and Aging Services vision is that San Francisco is a city where people with disabilities and older adults are valued, engaged, and living with dignity. And for us, the village model embraces that vision fully. So we are very pleased to be able to partner with the villages, and it just helps us, again, serve a population that we can't. So with that, I will turn it over to Kate.
Thanks, Cindy. So I get to talk about how this partnership with the department has really been a game changer for our villages. I started with San Francisco Village in early 2012. And I think it was within that 12 months, the next 12 months, that I learned that we were going to get this $50,000 in add back funding, which just really, it did change everything. And I want to speak specifically about capacity. I don't have the numbers for Next Village, but I'm going to assume that their rate of growth has been fairly similar to ours. So I'll just say that since receiving these funds and being in partnership with these wonderful people, San Francisco Village has grown from a staff of 2 to a staff of 6. We've gone from 120 members to 470 members. From 20 non-member volunteers to over 200 intergenerational volunteers. From 10 programs a month to over 50 programs a month. I don't believe that any of this would have been possible without the supportive relationship of San Francisco DOS. And it's more than the money. The money is incredible because it enables us to hire people and do these important things. But we have thought partners and problem solvers. We have relationships with people in the department that care about us and that care about our success, that advocate for our success. And our relationship with DOS, as I think was mentioned earlier, has really legitimized us in the local aging services network. Early in the pandemic, we turned to a technology partner. I talk here about we've acquired a state-of-the-art operating system. In early 2020, a local technology startup named Mon Ami had a mobile matching app that they were using in a for-profit business. Well, their business was sidelined because of the pandemic. And there are 2 sharp young women who turned to DOS and offered their technology for free to any nonprofit in San Francisco that was trying to connect older adults with younger people to go grocery shopping and do the things that we needed in those early, really scary months of the pandemic. And I think there were 3 or 4 or 5 organizations in San Francisco that took up DOS on that proposition. Here at San Francisco Village, we became a beta site for Mon Ami so that they could develop an operating system for villages that not only included a mobile app for volunteers, but all the other things that we needed to run a multifaceted membership organization. So the Department of Aging offered to pay for it. It was a big expense that none of us anticipated. After the donation period was over, DOS offered to pay for it, and they're still paying for it. And the really good news about that is that we have a group of people at DOS that share that innovative mindset. They're looking for opportunities too. And they realize that villages, as somebody said earlier, are nimble. We're able to take advantage of opportunities quickly. And this was one of those examples. So I'm happy to say that actually we're introducing Mon Ami, the technology system, to Sacramento, to the California Department of Aging, as a possible replacement for the, the antique that they're currently using. So the other thing I mentioned here about office space, we moved into an office here about 6 years ago, and we didn't have any money beyond rent. We couldn't have renovated the space like we needed to. So somebody at DOS introduced us to another city department that was able to find funding for us to get the improvements that we needed. So the relationship has so many arms and so many different ways that it has manifested. And then what I say here about leveraging dollars with other funders, I think many of our current funders, whether they're foundations or major donors, they look at this relationship with DOS and they feel very reassured that the city's invested in our long-term viability. And funders love that, right? They don't want to be the only one, and they don't want to be investing in something that's kind of, iffy. So this has really given us a very solid legitimacy. Also, the fact that DOS is recognizing the forgotten middle. which is kind of an argument that we've been trying to make for as long as I've been here, 11 years, that this is a really critical, as Jacqueline mentioned earlier, you know, it's we're in a precarious position with moderate to middle income people if we fall off that cliff. So we want to be able to support them for as long as possible to stay at home and live independently. And I think all of us in the Village movement share that kind of intention. And then what I will also say is that to kind of conclude here is that we started Village Movement California about 4 or 5 years ago. And we believe that the long-term sustainability of the Village Movement is going to require partnerships with government and business if we're going to succeed in the long term. And by business, we mean mostly the healthcare industry. Because of the advocacy of Village Movement California, villages are included in the California Master Plan for Aging, which was started by our Governor Gavin Newsom 4 years ago when he came into office. A master plan being that we have a plan that outlasts a governor's tenure, you know, that we have an idea of how we're going to support older people for the next several decades. So what we did is we make the argument at the state level for what's possible. I like to draw attention to this relationship between San Francisco DOS and the local villages to say to the California Department of Aging or any other AAAs in California, look at what's possible with the right investment. We were able to build capacity. We were able to legitimize ourselves in the aging services network. We were able to build an infrastructure for social care for moderate to middle income people that is going to serve them long after all of us are gone, I predict. So that kind of systems level change, it excites me. And I'm so grateful to San Francisco Department of Disability and Aging Services for having a visionary the visionary leadership to help us in this regard. So I think that's all I have. And now I'm going to hand it back to Barb.
That's fine. And we're going to pass it along. Thank you all. That was great. And there's a ton of questions, so we'll get to them. We are now going to move to Finley Lake and New York. Travis, do you want to do the slideshow first? Do you have that up?
I thought Finley were doing their own slides, but I can pull it up.
No, I don't think so. Marianne, are you doing it? No, I've got it up. Do you want me to pull it up?
I knew Barb. Sure.
Okay, hang on 1 second. Marianne, why don't you go ahead and introduce everybody, or LJ?
Sure, yeah, because we're all in the same room, it would be good. And so I'm Marianne Spanos. I'm the director of the Chautauqua County Area Agency on Aging. And in the room with me is my colleague, Chris Chironis. Go ahead, Chris.
Hello, everyone. I work for the Office for Aging, and I'm also the liaison and board member for Finley Lake Vice President, Community Connections of Finley Lake.
And to my left,
I'm Lynn Bayless, the Executive Director of Communications. She got me all into the communication thing of Community Connections. And this is Marlene Garone. I'm the NORC Director for Community Connections. Judy?
I'm Judy Hunt, and I'm the board chair. Privileged to do it.
and one thing that Lynn did not say is that she is also on the board of my AAA.
Oh, yeah, that's true.
So next slide, please. So I wanted to give you a little snapshot of where we are. Carol, you did such a fabulous job talking about, you know, AAAs and the differences between them and villages. And but I want to, in New York, we are county by county. So there are 59 area agencies on aging. And this is a little map of our county, and the nice blue is where Finley Lake is located. So you could see it's really a rural area of our already rural county. We don't really have any big cities. The largest city is Jamestown at 30,000 people. So Next slide, please. And again, Carol, you did a great job talking about the alignment of our mission. So I won't spend any time here, but we're all wanting to help older adults age in place, and there's really enough work for everybody. Next slide. You also did a great job, and this is discussing the differences. But I do want to point out, about that specific program requirements, the funding from the federal, state, and local governments comes with a lot of requirements. And not only are the area agencies required to report that data quarterly, but we're also, if we have a contract with somebody, we're required to go out and audit and oversee what's going on and make sure that all those program standards are being followed. Next slide. So here's really the meat of why I think that our partnership is so successful, and any of my colleagues around the table can jump in and say, but we really spent the time up front understanding each other's scope of work. And while you mentioned the community needs assessment, going along with that is an annual plan and public hearing that I encourage the villages to take note of that, show up for those public hearings that your area agency on aging is having, and comment on what their plan is. In New York State, we have an annual plan, and then we do a larger plan with the community needs assessment every 4 years. Again, we talked about there's some constraints in contracting with state, federal, and local. But sometimes those can be worked out, where there's a will, there's a way. We have different requirements on membership. Basically, the area agencies are serving this age 60 plus population, but often we can serve disabled people and caregivers. And sometimes there's requirements on the services that we provide. Like the in-home care services. It's not just anybody who wants a meal can have a home delivered meal, or anybody who needs help with, wants help with housekeeping can get a housekeeper. Under the Older Americans Act, there has to be some demonstration of deficits in your activities of daily living in order to get those services. So it's really important for villages to understand where AAAs are coming from. That doesn't mean that other people, as has been mentioned in the other examples, can't use help and support. It's just not always possible because of the criteria of the Older Americans Act and the funding that we have that's limited. So let's go on to really where you want to. I tried to put examples on this slide of ways in which villages and AAAs can work together. Some opportunities. This is not an exhaustive list, but a lot of these things are things that we've helped each other do. One is, we have under the Older Americans Act 3D program, an obligation to provide health and wellness programs, evidence-based health and wellness programs. And we've done a lot of that in Findlay Lake. There's also, prior to the forming of Community Connections, we worked with the senior club here to provide Healthy Bones, which is the Tufts University Strong Women's program. So sometimes the AAA is training volunteers at the village to do this work, and sometimes the AAA is just coming last year with powerful tools for caregivers, and I think Eat Healthy,
It's
Be
going on right
Active.
now. Currently.
That's a SNAP Ed grant, a special grant, doesn't really come through the Older Americans Act, but we were chosen by the State Department of Health and New York State Office for the Aging because the underutilization of SNAP in our area. And so that's a dietitian-led program. I'm just going to skip down. Somebody mentioned the state health insurance program. New York State always has to call things differently. And in New York State, it's HICAP, Health Insurance Information help me, Chris.
Health insurance information assistance program.
Assistance program, right. But really what this is Medicare insurance counseling. And this is one of the first things we trained some of the village staff to do, because so many people, Medicare is changing every single year. And so many people need we call it the annual checkup. That's Chris's words, because she's our high cap guru. But they need a checkup on their insurance. They don't want to have that rude awakening on January 1 that all of a sudden their Medicare plan is changed and no longer covers what they need. So these are some examples of different ways that AAAs and villages can collaborate. There's so much need around transportation. I can only do so much, and I know the villages are providing their own transportation. So we're not necessarily doing that together, but what they're doing is kind of complementing our services. We've certainly worked together on different, it was mentioned about the dementia-friendly communities. We were one of the first dementia-friendly communities in New York State, and have worked on Dementia Friends together and training businesses. We've also done some things on preventing financial exploitation of older adults, and invite the villages to come to our programs, or sometimes they host a program and we'll provide speakers. Most recently, we, as a lot of our nutrition congregate meal services shut down during COVID, we were working very closely with Judy to get our a meal service back up and running here in Finley Lake. And we're finally successful a couple months ago. So there is a lot of opportunity. A couple other areas that I didn't touch on, but employment. Certainly there's a home care worker shortage. And many AAAs have a Department of Labor grants to put older people to work under the Senior Employment Program, which pays 20 hours, or minimum wage for 20 hours a week to gain on-the-job training. Another need is home repair services, which probably a lot of villages are doing small repairs and things. So, maybe the AAA could actually provide, if not paying the person who's doing it, getting you the equipment, whether it's the grab bars, the light bulbs, the ramp itself. But that's certainly an exhaustive list, but some things that we've all thought about together. Next slide. I think you went back rather than went forward.
There we go.
So here's our contact information. And I think then we have a little video.
I think that's
We're
Travis.
working on them, getting the
Okay.
sound on here. Oh, let me check. Let's see if this works. Hmm. Hmm. Try to share it again. 1 second. Well, it was playing earlier. 1 second, stop share. I'm trying to bring it up fresh.
Best laid plans.
I can assure you, it's well worth the wait. You just get to see it.
It does not want to play.
No. Do you have it on here?
Oh, wait a second.
There you go.
We've got the music.
1 second. It's decided it wants to play now.
Okay, good. Good job.
Uh-oh.
No sound.
There's not enough time to bring your computer up.
I wait for the volume, Travis.
It's ridiculous. Take it off. Travis too.
I don't
that-
know if that came across to anyone. We couldn't get it, so.
You guys couldn't get it?
No, it was shrunk and there was no sound, so I'm hoping that
we
didn't
got, I
happen.
mean, you're getting big kudos.
Yeah, the chat is filled
The
with
chat has
kudos.
gone nuts. Yeah. So no, it might be because of your streaming, but no,
Yeah.
I mean, there are so many comments. Pictures 1,000 words. What an incredible video.
Oh,
So
Well,
yes.
it's better you see it than we see it again. So thank you.
Yep, everybody saw it, and we will put it in the files so that people can see it directly with the music in the background too.
Okay, good.
That was the only thing that was kind of missing. It was coming and going.
Yeah.
At this point, I'd like to turn it over to Mary Jane and Carol, if you want to field the questions.
Yes, we actually just have 2 more slides. Travis, if you could bring up the next slide. Okay, Leveraging Resources Handbook is the report that we wrote summarizing all these case studies and all the information that we learned. It will be available today
Now,
on the NVVG website. Is that a true statement?
it is live. It went live about an
live.
hour ago.
Okay, so you can go to the NVVG website and get your own copy of this report. And we hope that will engender a lot of thought and a lot of action on your part. And the next slide, please, Travis. And thank you to the San Francisco villages. We decided to adopt your title of game changer for the village. We know that we went through an awful lot of material in a hurry today, and there's just a great deal more information in the handbook. So we are doing Village to Village is doing a webinar on November 10th, where we will have more time to address your questions. You'll have an opportunity to look at the handbook and come up with questions and clarifications that you're looking for. And we will go in more depth about how to start a collaboration, how to keep it going, and the benefits and challenges of working together. I hope that you were all encouraged from what you heard today. I can say that it was so enjoyable working on this project and hearing about all the terrific things that AAAs and villages are doing around the country. So we're very happy to be able to share this information with all of you. And now we turn it over for questions.
Carol, before we do, I just wanted to say that the way to access the handbook is on the V2V homepage, and you just click on the image of the cover. And I've also put the URL in the chat there, so you should be able to access it there. I guess a few people have already done so.
As I see, someone has already downloaded it.
Yeah, right.
Several people.
Their link must be a lot faster than mine. Okay, do we have some questions?
So let's look here. I think Cindy, you might be typing an answer to this, but there was a question from Kathy Kuzma. How do you overcome AAA's not recognizing moderate income seniors as underserved populations?
I was typing, and I am 64 years old and never learned to type, so it's much easier for me to speak. So I would say, as was mentioned earlier, every AAA is different, and our funding sources, if it's Older Americans Act funding, there's very specific things that we have to adhere to. For us, we don't use Older Americans Act funding, so I would meet with the AAA and talk to them about their funding and what they are able to fund. So then, because you know your village and what you are able to do within that, and then help them have that conversation around what are some of the possibilities. So I think, as with all things, no one wants to make an assumption of what somebody else, and just starting those conversations.
Okay,
And
great.
I'll just chime in if you don't mind. I'm not only a AAA director, but I am the president of the U.S. Aging Board. And so Older Americans Act money does not really have any ties to the financial abilities of the person. So it really depends on, our state funding. In New York, we have a lot more money for in-home services that comes through the state, but that is on a cost share basis. So people who are very low income, just like people under Older Americans Act, are asked for a donation. And sometimes we request that donation, you should donate at this amount if this is what your income is. But there's no requirement of that. And then under state funding, if you're higher level income, you may be required to cost share. But again, AAAs are set up differently in every state. As you said, in some states, they don't have the Older Americans Act money. Others have both state funding and Older Americans Act. So.
Kate also has her hand up. Yeah.
Go ahead, Kate.
Thank you. I just wanted to insert here that I think that we were successful, both Next Village and San Francisco Village, by going through our County Board of Supervisors. I think if we had gone directly to the AAA 10 years ago, I'm not sure that we would have been as successful getting funding. But the County Board of Supervisors, once they heard from us, they commissioned the Budget and Analyst's Office to do an analysis of aging in place in San Francisco. And that report was completed around 10 or 11 years ago. And it indicated that the city was pretty underprepared for what was coming. And so they had a basis for saying, okay, we're going to give you some add back money. It's much more flexible funding. And they gave us that 50,000. And then once the 50,000 was set aside for the villages, then it had to be administered through the Department of Disability and Aging Services. And that's where that relationship really took root. But I just think it was really a good strategy that I wanted to emphasize, that going through the local elected officials might be there might be more flexibility.
And I can add to that a little bit, only because to all the villages out there that are really, we don't have the big boards, we don't have that kind of thing, which is why three of us just said, why don't we go see what they're doing? And we were very fortunate in the reception we got and the continued relationship. So I don't want the smaller rural areas to be discouraged if they don't know who the big lawmakers are. I think your approach was obviously excellent and the results were incredible. So we didn't have that luxury, that's all.
Okay.
I would just note that was also the case in the DC villages and some of the other case studies. So again, when you see the handbook, you will see that there are multiple instances of some of the things that you've heard from these particular case studies today. Mary Jane?
Oh, yeah. No, it's just going, if we're done with that topic, we do have a question for, I guess, for Dorothy for Chicago Hyde Park. Do you have liability insurance that prohibits you from serving members with dementia? And if so, how do you get around that? If not, who is your insurer?
I'm not sure who our insurer is, but I'm not aware of that being an issue. We are able to do the work that we do with dementia-friendly outreach. Our state works with the Dementia Friends programming, so this is all sort of under, as well as being a part of the Dementia Friendly America network. So we haven't, maybe this is an issue that I'll take back and see if there's an issue, but it seems like it's just part of the population that we work with, and it seems to me in some ways odd to take this particular population as needing to have special coverage within the insurance. It's just part of the population. Some people have visual impairments, some people have mobility issues, some people have dementia.
Yes, insurance is certainly a big topic for villages, and you see it in the forum, and we've seen it at this conference. So I know there is the, Barbara, you have the webinar coming up, right, on the 10th?
With the insurance, it's actually on the 10th. It's earlier in the day, but yes, we have somebody talking generically, not promoting, but talking about villages and insurance. And so it'll be a lively discussion for all villages, whether they're developing and mature villages. So
I just wanted to mention that, we used to get this insurance coverage issue more when transporting people, not specifically people with dementia. And we often partnered with our RSVP programs because they have some umbrella liability coverage. So that might be a collaboration with RSVP programs to get some extra liability coverage on your volunteers.
Okay.
And I don't know if everybody knows what RSVP programs are, Marianne, but it's not unilaterally across the country that program, it's a federally funded program for retired folks, and it has to be in partnership with sometimes public or separate entities to promote it. So
yeah, the retired senior volunteer
program.
program. They don't use the whole name anymore. They just use RSVP, but it's also called Senior Core. Foster grandparents is also under that that umbrella. In our county, it is in a separate entity, Lutheran Social Services. So if you look up, I think under AmeriCorps, you might find your RSVP programs.
Right.
We will
Okay,
I'll
there's
take this question back to our leadership and make sure that they've crossed their T's and dotted their I's as far as this. So thank you for that suggestion.
Yeah. Okay. There's a question here from Paul Sobel. How long did it take you to gain entry with your AAA's Gatekeepers? And I guess that would be directed to every village who's presented here. Somebody want to respond
About
to that?
15 minutes for us.
Ours was pretty easy.
We walked in the door and it was amazing. And I think I mentioned on the video that it wasn't until we went to a VTV conference that we found that was unusual. And that's why we answered, I think it was your question, Carol, on the email, because we did not know that wasn't, and sometimes it's good you don't know what you don't know. And I think I give kudos to our Office for Aging, and they recognize that we were in an area that they couldn't necessarily get to. And it just, so about 15 minutes.
If you don't know who your area agency on aging is, you can go to the Elder Care Locator, acl.gov, and put in your zip code, and it will pull out all of the area agencies on aging and aging and disability resource centers and their contact information.
Excellent.
It's also a way to direct people to find out what services are available in their area. Especially I direct a lot of caregivers who live here, but maybe their care receiver is in another state. and they want to know what the services are there.
And if I could, in our case, I think we went fairly early on to the department. You certainly don't want to blindside them. If you're going to make a budget request, you want them to know that it's coming and to discuss the parameters of what you're doing, so that when they get asked by the mayor's office on budgeting if this is a good idea, or the supervisor, that they're aware of what you're doing. So fortunately, we have great access to our Department of Aging folks here.
And I would just add that we, of course, I already mentioned, met through an already established link in the state of Illinois. And the resource that Age Guide has created is then going to be available to all the, to anyone in the state of Illinois. So that's just, a wonderful cooperation. So thank you, Age Guide.
Just, we don't have any villages in our actual region, our coverage region. So the partners, this is a whole new network of people that we don't really in our coverage region. So we were happy to meet with Dorothy and learn more about, we hear about them, but we don't have any that we have been able to work with previously. So it's unfortunate to hear you all have difficulty accessing your AAA. So
Yeah.
Okay, I don't think there were any more questions, Barbara, but I think on behalf of the whole research team, we want to thank all of you, because you were so kind in giving of your time and your thoughtful contributions to our project. And I know Carol and Cynthia, Barbara would agree too. It was a wonderful project and you all contributed so much. So thank you.
Well, look in the mirror, Mary Jane. I mean, the hours spent, really.
Well,
so thank you.
It was
to
a
the
huge team effort. It really was.
But also thank you to everybody, all the villages that participated. It was definitely worth the 8 months. That the team, especially Cynthia, Mary Jane, and Carol. So thank you.
But please
And,
share. I want to just say one thing. Please share the handbook with your professional contacts. I mean, we want to distribute it widely, and you for taking that on as well. As
Cynthia just said, thank you to Next 50 who gave us the opportunity to do this guidebook. Right. So thank you so much. Well, we are going to roll into our days. I'd like to reintroduce Kim Greer, who is the president of our board. Kim, I'm sure you have a few words to say.
I have very few words because, I mean, spectacular. I'm incredible, from the people who put this together, the board, the staff, everybody, the people who have joined and are on and attending. We're all here for a reason, and the reason I think is to this has just been amazing. I just also wanted to say, for the research team that put together the Leveraging Resources Handbook, they're not going to toot their own horns, but holy cow, the amount of time that they put a product for the network, I just cannot say enough about the work that they did to get this put together. And so, in the words of not Rosalind Carter, who said, "Seize the moment," as we heard yesterday, is let's not stagnate, but collaborate, because we can't do this alone. And this is too big for any one of us, but to collaborate and move forward, we will get to where we need to be to help the people we serve. So thank you so much for all y'all.
Well, thank you. And thanks, Kim. Here's a reminder of all the additional upcoming follow-up webinars that we're having. Starting this next week or in 2 weeks, the Impact Project is going to be on the calendar if it's not already, and you can sign up for it. The Vivo demonstration, again, will be at the end of the month. One of our great sponsors, Caption Call, will have a presentation, and then our leveraging resources with the team and the AAAs all welcome on November 10th. So we encourage you to look at our calendar. And I think last but not least, I have to really thank Travis and Steve Gurney for all their hard work and everybody who contributed to this. You know, it's a lot of work putting on a conference, but it's even more hard, you know, in the virtual world. I think it's a lot easier in person, which brings me to the poll we did back, you know, at the beginning of the conference on whether or not you wanted to do an in-person conference or not next year. And the numbers came in, you know, about 45% of you said yes, they would want a in-person, 20% said no, and 35% said that they would possibly, you know, attend an in-person conference. So that being said, I think our exploratory team is going to look at some regional conferences, one-day workshops, and we will talk to, and it'll be regional, so we'll hopefully talk to our network providers in the regionals and see if we can do a joint type of in-person conference, one day kind of workshop. Again, thank you all. Thank you, my board, great supportive, and have a great weekend.